And the nursing student and I were both, something's not right here. It's just something's not fitting. This doesn't look like pneumonia. And I figured out that we were in a lot more difficult situation, a lot more complex and critical when I did a flu swab on the patient and I pulled it out for the swab, and I noticed that it was pink frothy on the Q-tip, and my nursing student looks at me and kind of turned around and goes, "That's bad." And I went, "Yeah, that's bad."
How do you help a preceptee manage their anxiety?
That one, you have to walk a really fine balance between false reassurance and true reassurance.
Talk about that.
So if an orientee is anxious, so an example would be me. I was horribly anxious in nursing school, and during my orientation, I was incredibly conscientious. And looking back on it, I know I performed well, but I was still very unsure of myself to the point where I'd be really hypercritical and go, "Oh, I could have done that better." And I always compared myself to the more experienced nurses who just looked like superheroes to me, the way that they handled their day. And one of my preceptors said, "This is not something that you're in your first year. It's going to take you at least a year to get close to looking like that, and that's okay."
What kind of advice would you give to someone like yourself setting up a new residency program for newly graduated nurses?
For me, it's not so much the topic or the curriculum. It's really about fostering that conversational relationships that they have with each other. And the growth that I see is when they can talk about their clinical experience and they can help each other.
It was like a compound of different things. We had the respiratory component, we had the septic component. There were lots of people in the room kind of moving around, and that was another thing that I was super proud of, is she executed all of these skills in front of who I try to impress, my boss, you know, our rapid response team, and giving a preceptee the confidence to do that in that kind of crowd is why I like doing that, you know, kind of like ignore them, look at me, it's just us, pretend they're not there.
Tell me what you mean by nurse presence and nurse voice.
Right. So I really think that's what the residency program is about. We don't talk specifically about skills, how to put a Foley or an IV. That's our other programs. This program, because we learn through stories, those stories are developing how can I be present for patients who are unkind or even maladaptive behaviors or angry or in tragic situations. So how can you be present with compassion at that moment for people that you may not feel compassion towards? But how do you see your role as being able to define that moment and not yourself? So we talk a lot about that nurse presence, and not just the negative, but also the beauty of what we do, and the power of being present for these patients. And when I ask the nurses at the end of the program, our last class, I always ask them, what story do you remember the most from this year? And the stories are always about their presence with patients.